Hello everyone, Dr. Langdon here, board certified pediatrician, mom of 6 and grandma to 2, with a little update on some definitions that maybe you're getting wrong for words. These are my choices of commonly used phrases by parents that don't actually mean what they think they mean. Sort of like on Princess Bride. You remember this? When Vizzini kept saying, "Inconceivable." And then Inigo Montoya corrected him and said, "I do not think this word means what you think it means." Same with these words. So the one that happens very commonly with us is croupy cough. The parents mean it that the baby has a wet, juicy, sounds like it should be productive cough, lots of junk in the throat. But actually, croup is that harsh, seal bark, hoo, 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 kind of a cough. So it's not wet and juicy. So when they say croupy, I always say, wait, do you mean mucusy as if to be productive, or do you mean harsh and seal bark like? So one, croupy cough. Be careful when you use that phrase. Number 2, projectile vomiting. Guys, this matters a lot because so many infants have reflux. It's practically physiologic. They have a floppy lower esophageal sphincter. Everything that goes down easily comes back up, especially if they have increased intra-abdominal pressure, like with straining to poop or rolling over. So they start spitting more around 4 months when they're rolling and putting pressure on their belly. All very common. Well, if you were holding that baby, maybe you were burping the baby on your shoulder and an effortless fountain, blah, splashed out, splashed off your hardwood floors, you would say, "Oh dear, that was a large volume reflux." But it wouldn't actually be projectile. Projectile means, for us, it's a trigger word for pyloric stenosis, which is usually around very young infants, like in the weeks, 3 to 4 weeks old, often firstborn male, but doesn't have to be. And it is genuinely gagging, retching, muscular, with forceful emesis, shooting across the room. That's what projectile means. It is like a projectile shooting across the room. And that could be a red flag for pyloric stenosis, in which it's not the lower esophageal sphincter being floppy, it's further down the pyloric sphincter or pylorus being completely closed. So every single drop that goes down has to forcefully come back out. And that requires a surgery. Very different from much less scary and common reflux. Okay, another one that comes up a lot is lethargy, or my child has been lethargic. So be careful. That's also a red flag for us. Something really serious could be going on with your child. We're concerned about maybe severe dehydration or other things that could be making your child be completely lethargic. But then I'll have a parent say that and the child's running around the exam room. That's not lethargic. Tired, yes, they could have periods when the fever spikes are going to get more fatigued and tired, but that's different than lethargy. Similarly to color change, parents will often say, "Oh, they coughed so hard they had color change." And what they're trying to say is that maybe the baby's face turned bright red, which I guess technically is a color change from their normal shade of beige or pink or brown. But when we say color change, we are concerned about cyanosis, or their skin being blue. So absolutely, if your child is having bluish lips, tongue, gums, big emergency. Absolute emergency. But most parents, when they say color change, that's not what they mean. They just mean they're bright red in the face. The other one, and I'll finish with this one, is parents telling us that the child is burning up, because that really comes with a connotation of very high fever. And if you're telling me that your child's temperature was, 98.7 instead of 98.6, or this happens all the time, if you're telling me that your child's temp was 98, but they usually run 96, so it's a high fever for them, I am so sorry. Do not take this personally. That is not a high fever. We still use the same numbers for fevers, whatever your baseline is. And all babies fluctuate throughout the day. All babies are warmer if they're super snuggled and they've been cuddling with you and they have a bunch of wraps and swaddles and blankets and onesies and thick outfits on. So a fever is still a fever. In a baby under 2 months old, certainly any fever above 100.4 degrees rectally is an emergency. Call your pediatrician. But for older kids, we're not quite so nervous. But for no children and for no adults, do we consider 98 or even 99 a fever, no matter what you say your baseline is. So when you tell us burning up, it's really lovely if we could get an actual number. We don't have to. And trust me, guys, we do not mind a bit if you go ahead and give your child, not under 2 months, that's a special case, but your toddler or older kid, some Tylenol or ibuprofen to help with the fever if it's making them feel crummy. You do not have to bring them into the office to let me see just how bad off they are, please. So I hope that helped to clarify some language. Thanks. I meant by that you don't have to bring them into the office without giving them medication to let me see how bad off they are. Of course, we want to see them if they need to be evaluated for the source of their fever, which we generally recommend. Same goes, by the way, for breathing treatments or a rescue inhaler use. If your child is wheezing, please treat them as we've previously instructed you to with a fast-acting rescue bronchodilator medicine like albuterol, and don't feel like you just have to let them wheeze all night, wheeze all day until I can see them so that I can hear the wheezes. I will believe you, I promise.